Cataract is a very common eye condition. Simply, cataract means clouding of the lens inside the eye. So let's look at this eye model and take off this top part. And this is the eye. So this is the cornea, which is the clear front part of the eye. And this is the iris, which is the colored part of the eye. And this is the lens, which sits behind the iris. The main function of the lens is to focus light, which passes through the eye into the retina to create a sharp image on the retina. Normally, the lens is crystal clear, and when this lens becomes misty or foggy, this is what we call cataract. Cataract usually forms due to aging of the lens protein, and this will change the lens from crystal clear to a cloudy lens, which is the cataract. A cataract or a cloudy lens will scatter light as it passes through the eye, leading to blurred vision. For people who have cataract, they usually feel as if they are looking through a frosted window or a foggy window. Cataracts can cause a wide range of symptoms depending on the severity or the type of the cataract. Patients often complain from difficulty in reading road signs or small prints, or their vision is getting gradually foggy or misty. Some patients may complain from glare from lights, especially during driving at night. Some patients may describe fading of colors, or colors are not vivid as used to be. In the majority of cases, cataract develop due to aging of the proteins inside the lens. However, there are some risk factors may accelerate the process of cataract development, like diabetes or smoking or previous eye surgery or prolonged use of certain medication like steroid containing medications or previous treatment with eye injections. When cataract interferes with your daily activity or your quality of life or your day-to-day tasks, treatment is recommended. And surgery is the only way to treat cataracts by replacing this cloudy lens with a clear plastic lens. Stronger glasses or eye drops will not help on that situation. Fortunately, modern cataract surgery is quite quick and safe surgery with high success rate. The surgery is usually done under local anesthetic. Most cases it's only numbing drops. Looking at the eye model, the surgery is often done by making a small incision in the cornea, the front part of the eye, which is usually about 2 millimeters in size, and then the instruments go through this small incision to break up the lens into smaller particles, and then these smaller particles are vacuumed or aspirated outside the eye, and when the lens is removed, a replacement lens is injected inside the eye. The replacement lens is usually made from soft material, so they can be folded, and then once inserted inside the eye, they unfold and settle in the lens natural place. These small incisions are self-sealing, which means that no sutures are required and the recovery is quite quick. So most patients feel a difference in their vision from the next day after the surgery. As we mentioned, when the cataract is removed, a replacement artificial lens is inserted inside the eye, and this new lens will focus the light on the retina to produce a sharp image. Fortunately, with the recent advances in technology, we have many lens options available for eye surgeons to use, and the decision about the certain type of lens implants depends on many factors, usually patient's needs and his eye condition. Generally speaking, there are four main types of lens implants. Monofocal lenses. These lenses have a single focus and they are the standard care after cataract surgery. They aim to correct the vision after surgery for distance, which means that you will need reading glasses after the surgery, like most senior people. Toric lens implants. Toric implants are suitable for patients who have corneal astigmatism. Astigmatism is simply when the cornea, the front part of the eye, has the shape of a rugby ball rather than a sphere. The toric implants can correct this astigmatism like in the prescription. Extended depth of focus lenses. This new technology of lenses, they elongate the focus of the image, which may help to some extent increase the range of vision or the depth of focus, so they can give some distance as well as intermediate vision. Multifocal lenses. This category of lenses work in a similar way like varifocal glasses. They aim to correct distance as well as near vision. They work well for many patients. However, some patients may experience some glare or light sensitivity with them. They need very careful selection before the surgery. Cataracts usually build up slowly as we age, and early on they may not interfere with vision, and by time they may build up gradually and then making your vision more foggy or misty, and at that time surgery is recommended. It's a personal decision and depends on your visual needs. When you feel the cataract is affecting your daily activities or your lifestyle or your ability to read, surgery is often recommended. Nowadays, cataract is one of the most commonly performed surgeries worldwide. Fortunately, with modern technology, the success rate of cataract surgery is quite high and the risk of complications is very low. In general, like any surgery, there is a small risk of complications like prolonged inflammation after the surgery, risk of bleeding, or risk if any technical issue during the surgery, or very rarely infection after the surgery. Infection is actually the most serious complication after the surgery. The chance for that is usually less than 1 in 2,000. I often tell most of my patients to drive a week after the surgery. However, some patients may decide to drive the next day after the surgery or 2 days after the surgery. It actually depends on how comfortable you are with driving and also on your vision in the other eye.